And speaking of flu season, let's bring in Joy Burnett now. We have been talking a lot about the so-called twin-demics, the flu and the coronavirus. And Joy, you explained doctors at Johns Hopkins are urging all of us to get our flu shot this fall.
And Rick, that's because there are some concerns that the flu and COVID-19 could create some confusion because those symptoms are so similar. So they're urging people to get a flu shot. The coronavirus and the flu may meet at a dangerous crossroad this fall. They're being dubbed the twin-demic.
So these are two infections that are very similar in terms of how they present.
Here in Maryland alone, hundreds of people have been hospitalized because of COVID-19. Researchers say when you add influenza to the mix, that could be a dangerous recipe.
This may put an increased burden on our COVID-19 testing infrastructure, which has already been a little stretched to the limits because individuals suffering from influenza may think they're infected with COVID-19 and search out tests for COVID-19 with their healthcare providers.
For some encouraging signs, just look abroad. The southern hemisphere emerged from their flu season with low transmission rates. But researchers at Johns Hopkins say it could be that people there were taking the advice of wearing masks, staying at least 6 feet apart, and getting a flu vaccine. Steps they say people here need to continue to take.
And now is more important than ever that people get their flu vaccines.
And now officials are looking into this phenomenon called co-infections. This is where someone may get COVID-19 and the flu at the same time, but they're saying the evidence on this is inconclusive. Live at 7, Joy Burnett for WJZ.